More Oklahoma children are making it to their first birthday, but the infant mortality rate is still high compared to other states. The figures are even more discouraging among minorities. That's why an alliance has been formed to address issues affecting Oklahoma's African American population and reduce the number of babies who are dying way too young.
Oklahoma is clearly making progress in the fight against infant mortality. Joyce Marshall, Director of Maternal and Child Health at the Oklahoma State Health Department, says the agency has launched several initiatives in the last decade to bring down Oklahoma's historically high infant mortality rate. As a result, Oklahoma's infant mortality rate dropped from 8.6 deaths per 1,000 live births in 2007 to 6.8 deaths in 2013. Still, the number of deaths among African American babies in 2013 was almost triple those of white babies. While the disparity has shrunk since then, Marshall says it's still too high, and she believes several factors contribute to that.
But I think there are things we can do to improve, and part of it is providing, that they have the access to care, the resources, that they're available.
For too many mothers in the Black community, those resources are not available.
We have so many Oklahomans that are uninsured, and so they don't receive that care that they need because they don't have the funds in order to pay for that doctor's visit.
Twyler Earl is a member of the Infant Mortality Alliance, an initiative launched 2 years ago to develop a strategic plan to help reduce Black infant mortality rates in Oklahoma County by addressing factors which may be contributing to the disparities between Black and white babies.
Maybe safe sleep practices, maybe health practices, maybe the lack of access to health care, decreased social capital for some of the moms. They didn't know how to connect into resources. They didn't know how to plug into their community because the entire village was not raising the child anymore. It was mom by herself.
Poverty also plays a role for many single moms.
Sometimes those copays add up. Sometimes those costs of health care add up. But there are agencies and there's resources out there that would help you to be able to buffer some of those costs. But not everybody knows about those amazing resources.
Among the recommendations of the Health Disparities Task Force that Earl chairs is workforce development to give families the resources they need.
If we can possibly move some of our population and some of our Oklahomans to the point where they're actually getting additional training and actually obtaining those better jobs, they will then have access to better health care.
Another factor that affects health care is Oklahoma's historically high rate of teen pregnancies.
One of their number one reasons why those teenagers are not accessing health care is they're afraid to tell their parent. And so they're waiting later and later in their pregnancy before they inform anyone and not getting any of that prenatal care.
Marshall says that early prenatal care is vital to detect conditions that can develop during pregnancy,
such as gestational diabetes or hypertension, and then those can be monitored and controlled for the best outcomes for the baby. So it's very important to really have that prenatal care from the beginning.
And once the baby has been born, it's important that parents employ safe sleep practices to reduce the chances for sudden infant death syndrome, or SIDS.
The Department of Human Services has really done an amazing job of trying to get the word out to new moms about safe sleep practices. Why you would place the baby in the crib or place the baby in a baby bed versus in the bed with you.
The State Health Department has also launched a number of safe sleep initiatives to give parents information about providing their babies a safe place to sleep.
We work with the birthing hospital so that before the mother is discharged, they're educated on safe sleep practices, and they're also given a sleep sack, or it's like a wearable blanket for the baby that's safe, that they can sleep in and keep warm when they go home.
Since the health department began its infant mortality reduction program efforts 10 years ago, the Black infant mortality rate has decreased by over 25%, while the white rate has decreased by approximately 16%. Still, the Black infant mortality rate remains about double the white rate And Marshall says both rates are still too high.
Any infant death is too many in Oklahoma. We don't want any of our babies to die, and would like them all to be saved and be able to celebrate that first birthday.